Hi, Chuck. Good to see you.
Who's that?
That's Mary. I don't have my video on, so.
Oh, okay. Hi, Mary.
I saw Kevin's lips moving, but we can't hear him.
That could be how we want it.
Good afternoon, Ben.
Good afternoon, Chuck. Let's see, just taking a survey around. We're missing a few people, aren't we? I don't know that we have a quorum yet.
Mary is on there, but I don't think you can see her.
Do we have any idea who attendee 12, attendee 2, attendee 3, who they are?
Josh, you look like you're attendee 12 on my side.
Oh, on mine it has my name on it.
On mine it says attendee 8.
Oh.
For Josh.
Huh.
Okay.
Guys, go for Josh too.
Okay, yeah, I know some of them have actual names on mine. Like Jason says attendee 11. Ben says Ben Wick. Kevin's has his name. Linda's says attendee 4. So, yeah, so some of you have names on there. Others just attendee and a number on mine. So I don't know.
And by my count, we have 6, which is enough.
Which is enough? Okay.
You're not counting me as part of the quorum, are you?
I did not, sir, since you're unofficial.
Oh,
I've got Kevin,
Thank you, ma'am.
Mary, Ben, Linda, Josh, and the doctor. So 5. No, that's 6, right? 1, 2, 3. 6. That's what I got. 6.
Yep, 6.
All right. Well, I know that we are tight for time for back-to-back meetings today, so I'm going to go ahead and call the meeting to order. So thank you, everybody, for joining. I guess I should have asked Anna if she was ready first. Anna, are you ready and okay with me doing that?
I am ready.
All right. Sorry about that. So we're officially called to order for our Board of Health meeting on June 25th. And we will start off with a roll call. Anna, would you call roll, please?
Commissioner Mary Cooney.
Present.
Commissioner Al French. Commissioner Josh Kearns.
Here.
Councilmember Brian Beggs. Councilmember Karen Stratton. Councilmember Betsy Wilkerson. Councilmember Linda Thompson.
Here.
Mayor Kevin Freeman. Board Member Andrea Frostad.
Here.
Board Member Jason Kenley.
Here.
We do have a quorum.
All right. Thank you, everybody. Next up, we have our chair's report. And just wanted to acknowledge Mr. Chuck Hafner. He has chosen to depart our board off to bigger and better things, I'm sure, for him, but wanted to recognize his years of service. So he actually has served on the board since 2012. So he served the last 8 years as the board member here for both the City of Spokane Valley representative and then a citizen at large. Just wanted to thank you for your years of service to the organization. So thank you, Chuck, and thanks for being here to be a part of the recognition today.
Well, thank you.
I don't know if you want to say anything or any final words.
I can have a couple minutes. Yeah, you know me. I think that I want to do a lot of thank yous. This should be about yourselves, the board, the staff, and everything that they do in the health district. And I just want to start that, 8 years ago when Tom asked me to be on this board, I absolutely knew nothing about the health situation and what they did. All I know is there was a building south of the courthouse that was a funny looking building, but I never knew what was going inside of that. So when I came back with the first board meeting, I discovered there were just a lot of things that I was not aware of what was going on inside that building, and found out there were numerous situations that I, as the board member, should be made aware of in order to make a decision that was right for the community and right for the health district. And so I went to Torney and I said, Torney, I would like to meet with the division heads and their managers and discuss with them just exactly what important role they played in the health department. And so naturally went to Ann, who was the one that would set it all up for us. And so I spent quality time with each one of the divisions, and come to find out there were so many things that we as a board members should be aware of, because we critically make those policy decisions that's going to be affecting them and what they can and can't do. So to the staff, I greatly appreciated the amount of time, commitment, and the continual dedication that they have given to the Regional Health Board. And that reminds me of one of my professors out at Eastern. One of her favorite sayings was that work is love made visible. And when I looked at all the staff members and what they were doing, they were working very hard. So they loved their job, and so it continued that way. And so after I got through with the 101 classes for health with the different divisions, which were made possible by Mike, Sheila, Linda, Ray, Kyle, and their team members, and again, it was well organized by Ann, then I felt very more comfortable about sitting up there in the dais and trying to make those decisions. So again, a special thanks to the staff, special thanks to Ann and her crew, because without her and pre-planning, and all of you know that's worked in any kind of a committee, that she has all the information ready to go and things that we need to be sure of in order for us to continue and reach our objective. And then thanks to Amelia and Bob, because at this point in time, with the COVID-19 situation, they're working overtime. And for all of you, they're having to make those kind of decisions and what's going on, because I'm sure you're being pulled every day going to phase 3. And so you're in a difficult position, especially when we see that most states, it's getting worse. And it's not going to get much better if things continue going the way they are. And so I appreciate what they're doing. And then, of course, I'm really appreciative of the board members because of you, and you're making the policies that are so important for this health district. And secondly, is that those of you who have served with me and on different types of committees and how we work together to get the job done is phenomenal. And I just want to express my profound thanks to all of you that have done that. And then please remember, and the governing is making decisions that benefit the people you represent. And that's why you're sitting in those chairs. And I just want to thank all of you again. I'm going to miss you. I'm going to miss the action. And this is not goodbye. It's just so long. So I hope someday you'll offer a cup of coffee to me and I can come back and find out what's going on in the health district. So again, thank you very much.
Thank you, Chuck. Really appreciate it. And we'll miss the 6:30 a.m. meetings that you always used to like to call.
No, you won't.
No, we will not.
So,
And as in recognition of your service, $50 donation has been made to the Meals on Wheels Association.
okay, well, I say thanks to all of you, and especially with Karen, because she did make those 7 o'clock meetings. So thank you, Karen. Okay, thank you again, everybody.
All right. Moving down to the consent agenda. Is there anything on the consent agenda anybody wishes to set aside today?
Mayor Wick, this is just, Ann asked that Brian and Karen and I and Betsy identify when we're on the line. So I see Karen and myself. I'm not sure if Betsy is yet, but we're here. So I just wanted you to know.
I see Betsy's name, so appreciate that. So
Okay,
welcome.
great.
All right. Anything for consent agenda to set aside? Hearing none.
Approval of the consent agenda is presented.
Councilmember Thompson?
Yes, sorry, I blipped out there. We had a power surge and I disappeared for a minute. So I hope I haven't missed, but I need to recuse myself from the financial statement vote.
Okay. So we're going to consider the consent agenda, which we have a motion on the floor all at once. Do I have a second on the consent agenda first? I'm going to call
Second.
somebody. All right, there we go. Thank you, Betsy. And so all those in favor, please signify by saying aye. Aye.
Aye.
All those nay. Abstentions? Councilmember Thompson. Yep. All right. Motion is approved. Thank you, everybody. Now we're down to action items, which is resolution 20-07, adopting a Spokane Regional Health District equity response. And I know there's going to be some discussion here on this one, but I just wanted to kind of start off that this was one kind of in response to the community. I know that we haven't really sent it through our policy subcommittee for review. And so I apologize that this hasn't been our normal process to go up to the board. And so I guess my thought would be to give it to the policy committee so that way we review our standard process, but I'll open it up for I know Brian wanted to comment, so go ahead, Brian first, and then we'll get to Councilmember Thompson.
Yeah, thanks, Mayor. I just wanted to say this did come up at our executive committee because of current events, and lots of people are making statements and community members are asking, where do people stand? And so a lot of people are doing that. So a few of us, including myself, thought this would be a good idea to get a resolution, and we asked staff on pretty short notice to come up with something, and I thought they did a good job of it. But I also recognize that you know, we have kind of a regular order of business as well, and if people are feeling like they want more time, I'm open to more time. My only concern is I would love if we defer it to our next board meeting. And the reason I say that is the policy committee hasn't really met this year for all sorts of reasons, mostly the COVID. It's not really COVID related, so we haven't met. And I wasn't the chair or member the previous year or so, but before that, when I was the chair, I had a hard time getting people to come to the meeting. So I would just hate that it get lost in the policy committee that hasn't met and might have a hard time getting a quorum together. So I am committed as current chair to call a meeting and get feedback from the policy committee that we can give to the board before the next meeting as best as I'm able. But I'd love for it to at least stay on the next board meeting agenda so that if the policy committee doesn't meet or people don't show up, I mean, I'll come to the meeting, but if no one else comes, that's not that helpful. So that's just my perspective on it. Thank you.
Thank you. Councilmember Thompson, did you want to say something? Go ahead.
Yes, I speak in support of having it go to the policy committee, and I am somebody who will show up when the meeting is called because I think this is really, I'm all about process and having voices at the table and talking. And the timing of this afternoon, the Association of Washington Cities is having our annual meeting right now, all virtually, but we're having a workshop this afternoon around equity with the REAL program at a National League of Cities, Race, Equity, and Leadership. And I think just having, being in the midst of these discussions, I support the resolution. I want to have us have a voice on this. I think it's important that our citizens hear from us. And but I do want to do policy, and I want to make sure we have a little bit more time to look at it. And so I'd like to see it go to the policy committee.
How about from our other members? Do we have some commitment from our other members?
Yes, I believe I'm on that committee, it's Dr. Kinley, and I would be glad to see. I agree. I think that we should. Well, I like the resolution, but I do think that we should send it to the policy committee and have a meeting on that. And I'm on that committee, and I will make that meeting happen, even if I'm not local, because at this point it'll be virtual anyway. So.
Yeah, this is Commissioner Kearns. I've sat on the policy committee for the last couple of years, and yeah, if you schedule a meeting, I will be there.
All right, we have some good firm commitments here from on the record from our policy committee to pledging that they will meet for you. Council President Biggs. So is there any? Go ahead.
Chair, do you need a formal motion to move that onto policy committee? If so, I move it to the policy committee and have it come up next month on the meeting.
All right, we have a motion. Do we have a second?
Second.
Okay, moved and seconded. Thank you, sir. Any further discussion? Seeing none, all those in favor of the motion.
Whoa, Ben, wait a minute. Hold up.
You got that seat.
Thank you. First of all, I want to say,
to the left and you're on the right on my screen. So I was like, what's off to the left?
I agree it needs to go to policy, but I also want to acknowledge, first of all, Dr. Lutz's leadership in this. But we can postpone, and I want to circle back around that we can wait, but you guys can wait because that's white privilege. That's my perception as a person of color, because this has been going on for a long time. Probably we should have taken a stand a long time ago because it is health related. So let's look at it, but don't lose sight of it that you come from a different perspective than Black folks, Indigenous folks, other folks who are not in your shoes and you are not in theirs. So thank you, Brian, for leading this committee. But I think time is not on our side. We waited long enough.
Councilperson Wilkerson, are you on the policy committee? I don't know if you can hear me or not.
I don't think Brian would let me on it. Just saying.
I don't know if we have a good Councilmember Thompson. Go ahead.
Well, I was just going to say that I totally respect and hear Councilwoman Wilkerson, because the health district has worked on this issue for a long time, and they have data, they have studies, but the board has never taken a position to move this forward, because we know that someone who lives in the East Central Community Center has a 12-year less lifespan than someone who lives in other parts of our city. We have had that data. We've had workshops. The health district staff has put on things. I totally agree that time is of the essence, but I want to make sure that we have it right and respectful for our community and our people of color and Indigenous people. The people who matter have to be at our discussion. So I would love to have Councilwoman Wilkerson on the committee. I think anyone could come to the policy committee to talk about this, because it is a major statement from our health district.
Yes. And thank you, Linda. And I will just respond that folks of color know there have been studies. I've heard there have been more studies about folks of color on every issue imaginable. And we've had studies amongst ourselves, but they're just out there and we study and then there's no movement. So at this point in time, we need to take the next step. And so that would be meeting and then voting on really what our position is as leaders in the health arena.
I appreciate your input, and like Councilmember Thompson, I was just hoping that we could get your input at the policy committee if you weren't already volume nominated to be on that. But however we can get your feedback in there would be great. So, and I think that the motion going to bring it back in July, we're only missing 1 month. It shouldn't be too bad, but I don't want to lose sight of it either. So I'm trying to be respectful on that. Any further discussion? Making sure I see all the way across my screen here. All right. All those in favor of the motion to table it to the policy committee and then, or to send it to the policy committee to come back for the July board meeting, please signify by saying aye.
Aye. Aye.
All those opposed, nay. Motion is approved. Thank you, and thank you for everybody on the policy committee. Next up, we'll have our administrative officer report.
Hi, good afternoon, everyone. I just have a couple of updates before I segue over to Susan Joberg to talk about the COVID-19 response, but a couple of things. One of the items that I inherited when I came here to the health district was that there had been a Title VI review and assessment of the agency, and there were some areas that we needed to get updated on. And one of those includes getting an updated form out to all of you as health district board members, because you're not employees of the agency, but we still need to capture some demographic data. So we're going to be sending out a form. If you could get that back to us so that we can get into compliance with Title VI, that would be great. That's also something that we're going to continue to, as we have folks serve on committees here at the health district that are not staff, right? They're external folks coming in, that will also get that Title VI information, which is race and ethnic information from individuals, because we really, you know, with that focus on health equity, need to make sure we've got folks on our committees that can represent our community, all of our community. So just once after this meeting, so that you all know, and we'll get those out to you to get back to us. We also have a new, and this was talked about at the last meeting, the conflict of interest policy that was sent to everyone. And there, along with that conflict of interest policy, is an acknowledgement and disclosure statement. So if you could please review that, and if you have any potential conflict, disclose that. And we can also, you know, get that on record here to make sure that we're paying attention to those things. I know Susan is going to talk with us about the COVID response, but any questions or things that I can answer for anyone?
Any questions? Mayor Freeman, go ahead.
So Amelia, does this policy, the conflict of interest policy, has not yet been enacted, so will this come before the board for approval?
It's an agency policy, and typically well, Michelle, maybe I need your, your input there. Actually, we were, I know for staff, we're enacting it as of August 1. But in terms of the board, I don't.
My recommendation would be that the policy does come in front of the board, if for no other reason than there are very specific statutory requirements that board members as quote unquote municipal officers are subject to. And so I think it would be appropriate for the policy to come before the board and have that presentation so that everybody understands what their obligations are. And it's a little different than the conflict acknowledgement for staff.
Can we get this on the next meeting then and get this presented and set up for board approval?
Yes, so then I will add it. So this will be this is what we have. And I'll just put it then into the July agenda.
So Michelle, sorry, Michelle, you vetted this?
In progress. So I am looking at it, yes.
In terms of our, we did have counsel who represents us for all of our HR matters review this for that purpose. Okay.
No further questions.
All right. So with that, the COVID-19 response is ongoing, and we've had lots of operational questions about different pieces and parts, and made that decision a couple of months ago to add the COVID-19 response agenda item under me, and I'm bringing in Susan because she's the expert. So, Susan.
Thanks, Amelia. Can you hear me?
You can.
Great. I appreciate that. And so I am happy to be reporting out on kind of where we've been over the last month. As you know, we were in unified command until June 1st, when we stood down the emergency coordination center and really moved the operation from a leadership role to the health district as the lead agency. And that includes our joint information system. And that also includes Facebook Live now happening and being hosted at the health district auditorium, which is new for us and seems to be going well this week. So we remain as an organization in incident command, and we've restructured our response organizational structure to reflect the positions that are currently activated. I am happy to report that I'm no longer the operations section chief. That's now Cindy Thompson, but she's on vacation this week. But in any case, Cindy and I will be sharing the responsibilities to make sure you have all the current information of what we're up to. We've made the incident command structure more of our own and reflecting priorities of public health. And so within the command staff, we've added a position of an health equity officer. And that is served by Helene Dewey, who's our health equity specialist, making sure that all of our response actions are always considered through a health equity lens. So timely to the previous conversation as well. As an agency, we are moving into an after action review process. And though we are definitely not in an after action place, we're in a mid action of the emergency. For the first wave, when we were in unified command, we want to make sure we capture the lessons learned from that experience. And so in partnership with a contractor, there'll be opportunities for input from all the external partners, including you as our board, regarding how SRHD has done so far in this pandemic response, and making sure that we're incorporating lessons as we continue to move through this for the next many months. Our safety officer, Kimberly Keeler, remains as a resource for a couple of our community locations related to safety compliance checks, particularly in partnership with our homeless sheltering operations. And internally, though you likely don't come to our building yet very often, our safety protocols are in compliance, and we will soon have temperature monitors at the doors of entry for public and employees that will replace the need for thermometers. In terms of our operations that are more outward facing, there's a lot of work, as you can imagine, still continuing. So I'm going to kind of go branch by branch across operations fairly quickly. Within the disease response branch, which now I'm identified as the branch director, that's where our epi and surveillance work is happening. And Dr. Lutz will be addressing kind of our current numbers and those things in the health officer report. So I'll skip over that part. Community testing, are finally operational with Multicare Rockwood and Airway Heights. It feels like it's taken quite some time, but they are out there, and the response from the community has been positive. They're only testing 3 days a week for 3 hours, but those 3 hours have been packed. So it's been a great response, and finally feel good about helping meet that need. We're also working now that school nurses are no longer committed to the official school year since it ended last week. They are all volunteering their time to do curbside neighborhood focused COVID testing with several school locations throughout the community to make it more walkable and accessible to many aspects of our community to be able to do COVID testing. So that's anticipated to start next week. in at least a few locations, and we'll publicize that well once we have all those nailed down. CHAZ, as one of our key safety net providers related to free community testing, is averaging about 150 tests a day, which is fantastic. And they also have a mobile team going into large households and other locations where their transportation and access are difficult, and providing testing on within homes for those families who choose that and are in need. Our isolation facility, as you know, moved from the fairgrounds to a hotel location in the Valley that opened on June 1st. It's fully operational and continues to provide support for people in isolation who cannot do that safely in the current living environment. We have served, the facility has had 85 bed nights, serving 24 unique individuals so far. So it's being well used for exactly the purpose that it's designed. Mobile triage and mobile testing. This is work that's continuing every evening to help monitor the health of those living homeless. It's a partnership with CHAZ and the Medical Street Outreach team from Washington State College of Medicine. And MedStar is our transportation agency that we're working side by side with when people are identified who need to move to the isolation facility. Infection prevention is that body of work that's specifically focused on skilled nursing and assisted living facilities with our most vulnerable seniors. Those outbreaks have really been minimized, and prevention assessments with these facilities is continuing. We currently still, only for the last 2 weeks, have had only 2 outbreaks in skilled nursing and 2 outbreaks that we're continuing to monitor in adult family homes. So that team has done a fabulous job. Medical surge and monitoring what's happening within our healthcare system. Those of you that participate in the recovery group conversation this week and had a chance to hear from Peg Curry and Dr. Getz, that continues just to be an area where we're trying to have confidence in the data that we're getting out of our institutions to make sure that we're ready to pull the trigger on any kind of next step. And Dr. Lutz is continuing to work hard with those various institutions to ensure we have actionable data. The Ready Healthcare Coalition remains active, and they're collecting information from all of the partners across Eastern Washington twice per week regarding resource information and coordination of getting those resources where they need to go. They're actively engaged with the disaster medical coordination centers in Eastern Washington, who have the responsibility for patient placement and patient placement communication. This is particularly critical with the Coyote Ridge Correctional Facility and some of the issues that are happening there to make sure any of those patients get placed in a hospital that can properly care for them. The next branch is our care coordination branch, and Ashley Beck, one of our associate directors, is overseeing that branch. This is one of those areas that was required in reopening our community, that we have care coordination available to help support individuals who need to remain in isolation or quarantine. It's a program that we're building in-house because we have a lot of skilled staff who already do some level of care coordination with different aspects of the community for different types of needs. They're building it as we go, while they're also helping support right now 36 different case contacts or families for the purpose of supporting them while they're in isolation or a rolling quarantine. The service is available for all of the case investigators and contact tracers to access 24/7 because needs arise all the time through the evenings, weekends, and holidays. Contact tracing is another branch being led by Steve Smith. And this is one of those other big buckets of work that's required of our community to have an army of contact tracers. This function is something that is usually part of a normal disease investigation, but with the volume of cases, clearly we need a lot more people involved. And so Steve has done a great job building out that program. And so I'm going to give you some of the totals of the different required areas that we need to have here. So the total number of non-epidemiologists SRHD staff who've completed the required training is 67. All staff have trained, including epi. That number is 73. Active case investigators and contact tracers are 17. The number of registered student volunteers to help with contact tracing is 71. And the volunteers who've completed the Eastern Washington University training and our SRHD HIPAA certification is 47. So our total is 120 trained contact trace staff. The state has had a bit of a delay in the platforms that are required for contact tracing and getting those out to local health jurisdictions. But we have been able to wiggle our way into being a pilot site so we can get going. And so all the epi staff have been registered and trained on the platforms that are being used for those. We've also hired a volunteer coordinator, Tanya Benzo, who is overseeing this army of contact tracers. And the protocols and workflows are being developed so that we can get busy once the software goes live. Our call center is still active here at the health district, and we average 40 calls or emails per day that are being responded to. And the fourth branch, really briefly, is our environmental and public health branch, and the branch director is Ray Byrne. That's the area that will hire and help us train the public health technical advisors to support businesses, schools, childcare, both in prevention actions so they can be open safely and following guidance. And if there's a positive case identified, how to mitigate that within their employees or exposed individuals who've come in contact with the location. So those have already been posted. Interviews are happening at the beginning of next week with the anticipation of start dates by no later than mid-July. It's the end of that very lengthy report. Any questions for me?
Any questions today? Well, thank you.
Absolutely.
Appreciate it. And we'll move on to our health officer report. Dr. Lutz.
See if I get the camera going. There we go. Hey, good afternoon, all. So a great segue from Susan. And so, of course, talking about COVID-19. So as of today, we have 1,122 confirmed cases. That's an increase of 31 from yesterday. We currently have 30 individuals in the hospital, of whom 18 are Spokane residents. And of those 30 in the hospital, 10 are in the ICU. We've had 37 deaths total over the course of the pandemic. One of the things I did share with you, and it's in your packet, it's a document that looks at what we refer to as community spread. And I really call this out because what we've seen, as Susan pointed out, and maybe a misperception on many people's parts, is that this emergency has not ended. It's actually picked up pretty significantly. If I look at, for example, right now, those 1,122 confirmed cases, 58% or 672 cases have occurred since Memorial Day, since we moved into phase 2. The last 4 weeks represent 27% of our hospitalizations. And I think of great note is that the demographic of who is infected has changed significantly. Early on in the pandemic, we were seeing sort of a broad swath, but certainly we heard about seniors being more at risk. And what we've seen over the last 4 to 5 weeks is that the age demographic that's most represented is that of those between the ages of 20 and 39. Currently, they represent 41% of our cases. And whereas this population started off primarily as workforce related, what we've seen over the last few weeks is that now it's more, or it's as much maybe behavior related as it is workforce related. So for example, Lisa Brian and I this morning were on a phone call. She works in environmental public health. We were on a phone call with a restaurant tavern, and without naming this institution, I now have 21 cases over the course of 2 weekends. And it's likely that I will have more individuals. This was a restaurant / bar tavern where physical distancing was obviously not being followed, where masking was not present based upon case interviews, and so of great concern. And so the behaviors are as much sort of propelling our infection rate as anything else that we're dealing with. And that behavior also is related to the wearing of face coverings, which, as you know, Governor Inslee and Secretary of Health Weisman came out a couple of days ago and formally to go into effect a health officer order across the state requiring the wearing of face coverings when in businesses and again, when physical distancing not possible. As Susan said, with respect to outbreaks, we only have 2 that we're currently monitoring in long-term care facilities. And Debbie Mbotha, who is in our EPI team, she and I visited the Veterans Home today. As you may remember, this was the site of our first significant long-term care facility outbreak. Very pleased to say that at this point, every one of those individuals who did not succumb to COVID-19 has returned. Interestingly, but not surprisingly, we have one individual who is still testing positive since the beginning of April. And they have taken what's called a test-based strategy, meaning that you have to have 2 negative tests more than 24 hours apart before you're considered cured. Most of us have gone with what's called a symptom-based strategy, which is one of the 2 strategies recommended by CDC, but it's also the more realistic one. It's 10 days post onset of symptoms or test date, and without symptoms and without fever for 72 hours. The reason being that people can shed virus for weeks and not be contagious, but nonetheless, they're still shedding virus, which is not infectious. So that's sort of where we are right now on the ground. As Susan pointed out, Coyote Ridge for us represents a bit of a wild card. If you're not familiar, it's a Department of Corrections site in Canal, Washington. And I was made aware of this about 2 weeks ago Wednesday, when I was contacted by colleagues at Deaconess because they, over the course of 2 days, found themselves admitting 4 patients into the ICU from the correction facility. Long story short, 1,700 plus individuals. They have had more than 100 residents test positive, almost 40 plus staff test positive, do not have local capacity to care for individuals who are sick with COVID-19. And so 4 what are called RCFs, regional care facilities, have been established across the state. Airway Heights was one of these, and they have capacity there to take on about 32 infected inmates. They have a small infirmary, but they are grossly short-staffed. And so we have been having a series of bi-weekly calls over the last 2 weeks to get a handle and understand what's happening. As I mentioned, a number of individuals from Coyote Ridge end up here, and they do end up because of their medical history that oftentimes, unfortunately, puts them at higher risk for hospitalization, end up in the hospital. So far, we've had, I don't know the exact number of DOC individuals up here, but there have been 2 individuals from Canal that have passed away from COVID-19. So that is, again, something that we're monitoring very closely, of concern, because right now we are seeing probably the greatest surge in hospitalizations in a short period of time that we've seen for quite some time. And as I mentioned, a bit of a wild card with individuals who may be transported here, who may end up requiring hospitalization, that stresses the healthcare system. So that's sort of where we are right now. Any questions? I'm sure there are many.
Dr. Lutz, what are our odds of assisting with Yakima County?
Councilwoman, assisting with and with respect to hospitalizations,
Yes.
you know, it's so READY that Susan mentioned to you, which is the healthcare network that monitors and assists with placement of individuals across the entire eastern portion of Washington. They assist hospitals and look for where resources exist. So far to date, what we've seen with individuals who are being transported potentially to Yakima, and or Yakima is transporting individuals west over the Cascades rather than this way. We had, you know, onesies and twosies of individuals who have come from the Benton Franklin area, but the majority of those individuals who are hospitalized in that area have been going west. But
Thank you.
to answer your question, we have potential. We have potential, but to date, it's not been primarily what's been used.
Dr. Lutz, is there still any discussion of opening up and I cannot remember if it was Swedish or whose hospital was closed in Yakima? I know that stood ready as potential because it hadn't been decommissioned fully. Is there any discussion on reopening that as a COVID center?
Mayor, you know, I do not know. I do not know if it has been opened. It may be opened right now. I don't know that for a fact. I know that certainly the Yakima area has, over the last couple of weeks, it's definitely been all hands on deck. But whether or not that facility was actually opened to serve as a facility, I'm not quite sure.
Another way, Councilmember Stratton, you had your hand up first, and then we'll get to Mr. Kinley.
Actually, Councilmember Wilkerson took care of my question. She asked it. Thanks.
All right. Mr. Kinley?
Dr. Lutz, question. The positive cases that we're getting, are they symptomatic? Because you alluded to that there was a test case where they had the test case where they were testing positive for the last couple of months, but they were not shedding because they were not symptomatic. And that's one of the biggest questions people are asking me. They're coming and saying, so are these people asymptomatic carriers or are they symptomatic when we're getting all these new cases? Because we expected an increase due to an increased number of tests.
You know, so it's a little bit of both, Dr. Kinley. What I would say is that it's been impressive for me, especially talking with young people, that a significant percentage of these individuals do not have symptoms and or very minimal symptoms. I was fortunate enough to go out with the Chaz team a couple of weeks ago and just talking with patients as well as doing testing. A number of individuals had no symptom other than what we are now identifying as sort of a signature symptom, that of loss of taste and smell. So talking to people, they found themselves having to add more salt or hot pepper or sugar to their food because it just didn't taste like anything or it tasted weird. So we've certainly seen that as one of the minimal but very pathognomonic symptoms of COVID-19. We are definitely doing more testing, but again, I think it's interesting when I look at the overall amount of testing compared to the volume of cases, it's not proportional, meaning that although we are doing more testing, proportionally, I'm seeing more positive. So for example, our positivity rate when our case rate started to go up was almost 8 to 10%. It's dropped down considerably, but it's still higher. We typically would like to see a positivity rate of about 2%. That indicates that you are able to sort of adequately test all the people that you need to test to be in front of the pandemic. We've hovered in the 3% range, oftentimes around 4%. But again, during this uptick in cases, we were 6, 8, almost 10% for a period of a few weeks. One thing I also want to, and again, I apologize, I should have made mention, that document that I shared with you, and maybe I already said this, I apologize, but I'm looking at right now, almost 30% of our cases are what we refer to as community spread, meaning that when our epidemiologists and disease investigators reach out and ask the individuals, where do you think you became infected? Oh, a family member, oh, somebody I worked with. Those are epidemiologically linked versus, I really don't know. This is where I've been. Those are evidence, that's evidence of community spread. And we've gone from a place where, a month ago, 5 weeks ago, 85 to 90% of our cases were epi-linked. Now we're down to about 70%. And so that's of great concern.
All right, and just not to be disrespectful, we'll have one last question here before we have to move on to keep our time schedule here. Commissioner Kearns, go ahead.
Dr. Lutz, I saw a stat that was in, and I apologize, I can't remember. It was one of the local media outlets said that the industry that was seeing the highest rate of infection was healthcare. Is that still a stat that holds true to transmission, that it's healthcare professionals, or is there another industry that has kind of eclipsed that the healthcare industry as far as rate of new infections?
Yeah, certainly, Commissioner. One of the things we've noted, we know that healthcare workers in and of themselves are a very high risk population, and that risk has not decreased, albeit with more PPE, and it's gotten better, but they still represent a high risk population. I think what's of note is that there was a report last week on our health officer call from an epidemiologist who's been working, he's from the CDC, but working in Seattle, King County. And of the 130 plus worksite outbreaks that they were investigating, first, the highest number of outbreaks were in retail. This was followed by restaurants/taverns, followed by food production, followed by construction, followed by production that was not food related. So healthcare workers, definitely a very high risk population, but we are seeing, especially in Washington state, but also nationally, as communities are opening up, those areas where, again, you have close proximity for extended periods of time, those are high risk work settings, especially if PPE is not readily available.
All right. Thank you,
Can I ask
Dr.
a
Lutz.
question? Am I being heard? Or is my?
Oh, I
This is
hear you
Andrea.
now. If you have a quick one, go for it.
Well, I don't know if it's quick or not. It depends on the answer, I guess. But you were mentioning that the rate you were looking for was like a 2%, that the hospital systems could handle that.
No.
Yeah. So is that's like a rate that's doable? Is it possible that is there possible there's a systemic rate of false positives with that PCR test, or any cross reactivity? And then also, what is those who are susceptible? Is that 100% of the population, or is that changed?
Okay, there's a couple of different questions there. So let me see. The 2% rate is not a function of hospital capacity, but rather it gives you a good idea that you are testing sufficiently across the community, that you are in front rather than behind the infection. With respect to the actual tests themselves, the PCR test, no test is perfect. They all have a false positive and a false negative rate, but PCR tests, as well as some of the other tests, for example, the Abbott tests, those are considered, sort of the standard testing. So, with respect to those tests, again, no test is 100%. And then I think that with respect to false positive rates, the one test that we have had concerns about, and it's more of a false negative rate, are the Abbott tests, those quick tests, whereby we have a very high false negative rate of almost 50%, which is essentially a coin toss. And what we've essentially said is that if you get tested with an Abbott machine and you test positive, then it's a positive case. If you test negative, we're not quite sure and recommend getting a PCR, which again remains the gold standard at this time.
Okay. Thank you, Dr. Lutz. Can we go on to financial report?
Sure. The documents were all included in the board packet. Big thank you to Mayor Freeman for stepping into the chair role of that committee. Currently, we're on track related to our budget. The only thing I wanted to point out was that we have met the goal of getting 20% or greater into our unassigned reserves after we finally got the numbers from closing out last year and getting all the financials tied up. And then the CARES contract, we executed that with the city. We submitted the statement, or not the city, with the county for, we received the statements and I submitted a statement of work. So we should be getting that check here soon, which will again help our overall financial situation. And we currently have, we're reporting about almost $2 million related to the COVID response, 1.9 million. So I anticipate once we get that check, we can fix that deficit there. So if there are questions, I can take those.
Questions for finance? Thank you, Mayor Freeman, for stepping into the chair of the finance committee. So appreciate it. Okay, moving on. Next is our Board of Health member roles and responsibilities. I know we're getting close to our time, which a number of us have to go. How much time do you think you need? Michelle, do you think we have enough time in the next, say 15 minutes, or do we want to defer it to the next meeting?
I can go either direction, but since we're going to do the conflict of interest piece next time, we could do it all together, or I can do a quick overview now, whichever is the chair's preference.
Any objections to moving this to the next meeting? Seeing none, we will move this to the next meeting to go along with the conflict of interest. Thank you for being flexible. And our next meeting will be on July 30th for everybody, so please mark your calendars if they're not already. And that takes us up to adjournment. Do I have a motion to adjourn?
So moved.
All right. We have a motion. Do we have a second?
Second.
All right, we have a second. All those in favor, please signify by saying aye.
Aye. Aye.
All those opposed, nay. The motion is approved. Thank you, everybody. We are adjourned. 1:26.